Sulfonamides. In this session, we will be discussing about its introduction, mechanism of action, pharmacokinetics, adverse effects, and uses of the drug sulfonamide. That's almost all its pharmacological aspect of the drug sulfonamide will be discussed. First, we can see its introduction part. Sulfonamide is considered as an antimicrobial agent. And when we say about its history or evolution of the sulfonamide, it was founded by Dommack, which is in the form of a dye, which is called as sulfonamidochrysoidine or prontosil red, which has been identified to treat streptococcal infections. Sulfonamide, it can be combined with trimethoprim to form cotrimoxazole, which is a combination of sulfonamide and trimethoprim, and also sulfonamide is combined with pyrimethamine, which is used for the treatment of malaria. Next, we can see about the classification of sulfonamides. Sulfonamides is mainly classified into 4 types: short acting, intermediate acting, long acting, and special purpose. Each category is having several examples. Among short acting is sulfadiazine, intermediate acting sulfamethoxazole, long acting sulfadoxine and sulfamethopyrazine. Special purpose sulfacetamide sodium, sulfasalazine, silver sulfadiazine, mefenide. Next, we can say about the mechanism of action. That's how this sulfonamides is work in our body. Its action. So, sulfonamides is considered as a structural analog of the PABA, para-aminobenzoic acid. It acts by inhibiting bacterial folate synthase enzyme. That's sulfonamides. They competitively inhibit the union of this para-aminobenzoic acid with the pteridine residue. If it has been binded, the result in the formation of dihydroteroic acid, which then conjugate with the glutamic acid to produce the dihydrofolic acid. Thus, the folate metabolism takes place. So, the folate metabolism is inhibited by the sulfonamides. This is how it acts. Next, certain bacteria, they can produce resistance against the sulfonamides like gonococci, pneumococci, E. coli, etc. They can produce resistance to the sulfonamide. And how this resistance which has been produced by this sulfonamide is like either by increase the amount of para-aminobenzoic acid or by the folate synthase enzyme which is having a low affinity to the sulfonamide. If that bacterial folate synthase enzyme is having a low affinity to the sulfonamides, and also one more is that like they can adopt any other alternative pathway for the folate metabolism. So this is how several bacteria that is producing resistance to the sulfonamide drug. Next, pharmacokinetics. So first we can say about the absorption. The drug is absorbed from the gastrointestinal tract and its extent of protein binding is like its extent of plasma protein binding is 10 to 95%. That's differ among different members of the group. That's we have already said about the 4 groups, 4 categories. So it will be differing and it is having a wide range of variation of that plasma protein binding. That's of about 10 to 95% of the plasma protein binding extent is there for the sulfonamide drug. And next, it has been widely distributed. When we say about the distribution, it is widely distributed in the body and they can cross the placenta freely. And when we say about its metabolism, it has been metabolized by acetylation process by the enzyme called acetyl transferase. And after metabolism, it has to be excreted. So the excretion from our body, it is by the kidney by means of the glomerular filtration. So it has to be excreted by means of the glomerular filtration through kidney. It has been excreted. Next, the adverse effects. There are several adverse effects like nausea, vomiting, epigastric pain, crystalluria, then several hypersensitive reactions like allergy, rashes, then hepatitis, hemolysis, and kernicterus. These are the main adverse effects which has been caused by the sulfonamide drug. And the last portion, that is the uses. So, sulfamethoxazole, which is one of the example, it has been used for many of the bacterial infections like nocardiosis. Okay, so it has been used in many of the bacterial infections, And also this pyrimethamine, as we have already discussed, this pyrimethamine which is combined with another sulfonamide which has been used in treatment of malaria. It is also used in treatment of the toxoplasmosis. It is also a kind of bacterial infection. Then one of the ocular use of the sulfonamide is that sulfacetamide sodium, that has been used as an alternative in trachoma. And one more is there which is having a topical application like silver sulfadiazine or mefenide, which has been used in case of preventing certain infections and it's also used in case of burn surfaces. So it is having a topical application. So among uses there is one of the ocular, that is sulfacetamide sodium, and one is topical application is like a silver sulfadiazine or mefenide drug.